Joining us now, Democratic Senator from Nevada, Catherine Cortez Masto, a member of the Senate Finance Committee who questioned Secretary Kennedy today. You had three Republicans say that they were concerned: Barrasso, Tillis, and Cassidy, as we played. Other Republicans on the panel cheered his leadership or encouraged him to go farther in questioning either vaccines, like hepatitis B, Roger Marshall did that, or the mifepristone pill, the abortion pill. What's your sense of what is going to happen next?
Well, Katie, let me just say, you were talking about it in the previous segment. If the American public watches that hearing, they'll see Secretary Kennedy does not have the ability to lead. He can't be trusted. He is causing chaos in our healthcare system, which is causing harm to Americans, and he's increasing costs. He really does not have the ability to lead. That was a concern that I had, and I think many of us had in his first nomination when they had the hearing, when he came before us the first time. It's clear he hasn't learned anything about the job. And that's the problem, because that's a danger to our healthcare system and to so many Americans across the country. So, you know, this bipartisan, Republicans, Democrats, whatever, what matters what the American public are feeling and seeing right now: high costs, a danger. They can't access the vaccines that they need to save lives. He's eliminating research and the dollars that we allocated for research, not just for Alzheimer's, but to ensure that we can take on, if a pandemic should ever happen again, that we're prepared for it. He does not have the ability to lead, and that's why I asked for him to resign. And I think many are asking for him to resign. He should not be the individual in charge of a federal agency for health and human services in this country that cannot bring calm, stability, safe and effective policies to the healthcare industry, because he is doing just the opposite.
I ask about Republicans and Democrats, and I make that delineation because if you want him to resign and you want to get him to resign, you're going to need more than just Democrats demanding it. You're going to need Republicans as well. And although those three Republicans expressed concerns, they were not demanding his resignation. So my sense is, when I ask where does this go from here, what is your expectation about RFK Jr.'s leadership and what he will be, whether he'll be contained or whether his moves will continue?
Well, Katie, let me just be very clear. There's one person that can make a decision here on this, and he sits in the Oval Office.
Yeah, but if all of the Republicans or more Republicans in Congress come out and say resign, that's what I'm looking at. Do they put pressure on the guy who sits in the Oval Office?
But I don't know, because right now the guy who sits in the Oval Office is dictating to the Republicans here in Washington what they should or shouldn't do. So really what it comes down to, from my perspective, is what's best for the American people. How do we ensure we're saving lives and lowering costs? You know, my conversation with him was about the fact that this administration is now increasing costs for seniors. And by the way, Democrats fought so that we had price negotiation, drug price negotiation, including going into this next round of negotiation, those cancer drugs that are essential to save lives. This administration actually extended that and pushed them off and exempted them from any negotiation. So now we have people that have cancer in this country, can't access the drugs that they need. Some of the drugs cost $175,000 a year for families. The Big Pharma is making $29 billion off one of the drugs, and they're not doing anything about it. So the question is really for all of us, not just Republicans, but in general, all of Americans to come forward. We are hearing from experts. We are hearing from sound science. We are seeing some Republicans who get the science of it, who are speaking out. Democrats have been speaking out, and we need more people to stand up. Look, Katie, you even have people that work within HHS now, and former employees who have said he should resign. I mean, I don't know how much more we need for the man who sits in the Oval Office or anybody else to understand Secretary Kennedy has no business sitting at the top of HHS. He does not know the job.
Is there something that you can do in Congress to mitigate some of this, to ensure access to COVID vaccine, as Eric Erickson is trying to get? He's fired back, by the way, at RFK Jr. saying that his wife literally went to get the vaccine, literally went to CVS, and CVS would not give it to her. Kennedy claims that it's not true, that he does have access. So
Well,
is there
that's what I
something
mean.
is there something that Congress can do?
Well, of course, and that's what we're looking at. Even in Nevada right now, we are talking with CVS because there's a challenge to get that drug out there, to get vaccines to individuals. But here's the deal. It's a perfect example of why Secretary Kennedy has no business being there. He lies. So how can anybody, we need sound science for our healthcare system, and the man at the top is lying about what is true and what isn't. So again, it goes down to removing him. He needs to resign, putting the pressure and keeping the pressure on at all levels, because he is causing problems and actually inhibiting people from accessing health care and medications and research in this country that will save lives. And let me just say another perfect example. I talked about the impact to seniors under Medicare. They're seeing increased prices, Part D and Part B. They're going to see it. And they're going to have to pay for it. When I asked Secretary Kennedy how he was going to lower costs for seniors, he didn't have an answer. He didn't even know that his role as HHS administrator and secretary oversees those policies when it comes to some of the Part B and Part D of Medicare. So there is a problem here. And it is beyond partisan politics. It is about doing the right thing for the American people to save lives and bring back the truth and data and science in this country. And so I think we all have a role to play here, and the pressure needs to stay on. I think he should resign, and he should do the right thing for this country and step up. I don't think he will, because he can't be trusted and clearly lies.
Senator Cortez Masto, really good to have you. Thank you for joining us today. I appreciate it.